opportunity to meet with your colleagues and explore some of what the week will have to offer. And now, on to our keynote speech this afternoon. Before joining the RCN, Nicola Ranger was Chief Nurse and Executive Director of Midwifery at King's College Hospital in London. In that role, she was already living and breathing the attributes that have led her to become one of the foremost leaders and innovators in the nursing profession. Her ability and determination to speak truth to power and to stand up for nursing staff and their patients has earned her the respect and admiration of her peers. When she addressed you at Congress last year, Nicola had just stepped into the role of leading our college on an interim basis. This year, on International Nurses Day, it is my great pleasure and personal honour to introduce her back to the stage as your Permanent General Secretary and Chief Executive. Please give a warm welcome to Professor Nicola Ranger.
Well, you know I cry easily. She nearly made me cry right from the beginning. Listen, good afternoon, everyone, and hello, Congress. Today is such a special day to be together. We celebrated it this morning, but let me say it again to each and every one of you. Happy International Nurses Day 2025. Globally, there are 29 million nurses. We are the majority of all healthcare professionals, and colleagues, as members of the Royal College of Nursing, you are part of the largest professional body and trade union for nursing in the entire world. Today, nursing is being celebrated the world over, and rightly so. And nursing in the United Kingdom has truly global roots too. Many of you in this hall today started your nursing journey far away from here. India, the Philippines, Nigeria, Ireland, Zimbabwe, Spain, Poland, Portugal, Italy, Guyana, Romania, Kenya, Botswana, and many, many more. But we are all in brilliant Liverpool this week, a great port city. So let me say it again, you are more than welcome in the United Kingdom. Thank you for bringing your skills to this country. Bigger than that, you've brought your lives here too, your families. You know more than I ever will how hard that actually is. The obstacles, the costs, even worse, the hostility. We want to crack down on that. Who saw the government on television yesterday? The Home Secretary cutting down on visas for care workers. The Prime Minister talking about immigration in a speech today. The UK is so reliant on overseas workers, especially in social care, and the government has no plan to grow a domestic workforce. This is all about politics, pandering and scapegoating. This should be about people. Let me tell you what this government needs to be doing instead. An immigration system that works for care staff and nurses, the people we rely on. Start with the policy of no recourse to public funds. Drop it. You live here, you work here, your rights are the same. Number 2, government, stop making money out of people's immigration applications. Profiteering of the very worst kind. You can bring these charges right down to the processing costs. Cut £2,000 off that fee. And finally, colleagues, grant indefinite leave to remain to all nursing staff without delay. Give people the security, respect and stability they need. Stop the game playing. And what better day for the UK government to do that than International Nurses' Day? The government is releasing the immigration white paper while we're at Congress. So let them listen to the debates later this week on how the system needs to change for the better. Because that's what we're about at the RCN, listening to nursing and leading for nursing. There are many opportunities for us to take, big moments on the horizon. The comprehensive spending review for the UK government next month, the NHS 10-year plan in England, health and social care transformation in Northern Ireland, elections in Wales and Scotland within a year. Each of these an opportunity. We will campaign and politicians will have to listen. There's a commission on social care. Who thinks we can wait till 2036 for change? There will be new legislation in Westminster as they restructure the NHS in England. Now, I've told ministers clearly, do not label nursing staff as bureaucrats to be scrapped on a bonfire. You are experts involved in safeguarding, commissioning and complex care. Instead, grab this opportunity and make a moment for real change. And real change is possible from debates we have here in Congress. Congress, only a few hours. Congress has only been open a few hours, but we've already heard from the UK government that they will be changing the law to protect the title nurse. This change in law was after the resolution was passed here in 2022 to campaign on this issue. The debates we have here don't just set the RCN's view, but can change the law, Congress. A campaign led by our Deputy President, Professor Alison Leary, and members Paul Travatt, Dr. Sally Bassett, and forums and our Professional Nursing Committee led by Rachel Hollis, alongside many of you, and recently with the support of Dawn Butler MP. Patients deserve to know who they are being treated by and know they can trust the knowledge, professionalism and expertise we bring. And this is the first step for political leaders to start to begin to properly valuing nursing as a profession. Respect, reward, investment to match the crucial nature of our work. Colleagues, it is now 5 years since the start of the pandemic, but we all still feel it, don't we? The effects of that time still sit below the surface of each of us. I remember one young man when I was at King's who was around 25 years old, and he arrived into A&E and was transferred straight to ICU. He later tragically died within hours. We had to put his finger on his mobile phone to find his next of kin, reading his messages to his mother about self-isolating, and then deciding which one of us was going to call her to tell her the news. Heartbreaking doesn't even come close. Every one of you will have those reflections about who you helped and who you couldn't, the sacrifices we all made. It's something that will never be forgotten. We are sharing your voices as part of the COVID-19 public inquiries, demanding that lessons are learnt and calling for serious recommendations that mean there can be no repeat. For some colleagues and for my colleagues, it hasn't ended. Those with long COVID. So many people forced out of their jobs into early retirement, devastating their professional pride and their personal finances. They should not be jumping through hoops to access benefits and support. It goes on in other ways too. Some nurses who are parents still tell me about the impact this had on their children. The fact that they were away from home for so long because they had to prioritise their patients. Some living in hotels to keep a distance from their homes for safety. Yet another sacrifice made by nursing. Colleagues, it still makes me angry, but determined. If we can get through that, surely we deserve better than this. Because this profession is a great one. Assessing, planning, implementing and evaluating care, specialised in complex interventions, our vigilance critical to the prevention of harm, the management of risk, compassionate leadership, values and integrity. We meet not just the needs of people, but organisations, systems and whole populations. Complex, evidence-based decision-making, the use of our judgments. We are not a list of tasks. We are a safety-critical profession. Nursing is an enabler of change and modernisation. We are not the status quo. We never have been and never will be. Leading clinics, running wards, communities, schools, care homes and hospices, researchers and academics, digital nurse practitioners, informatics specialists, nurse consultants, prescribers, nurses on executive boards, on oil rigs, prisons and the armed forces, in every facet of life and society. The 24/7 assured presence in healthcare, one that recovers somebody's health, improves quality of life, or to experience a dignified death. We do all of this with high levels of autonomy, with the hard-earned trust of our patients and colleagues. It is both an honour and a privilege. But I've got a question to ask today, and this is a tough one for me. Do we really value ourselves? Do we really know the value of what we do? Maybe we're too timid, too understated. Maybe we don't like being immodest. It's for others to be loud while we quietly and diligently just get on with the job. Or is it linked to being a 90% female profession? Look, there is no one more tenacious and outspoken than a nurse or support worker when you need something for your patients. Colleagues, it is time for us to do that for ourselves. Nursing has more than earned a higher place in healthcare and in society. That's what's at the heart of a new document we are releasing today. Agenda for Change, the contract and pay scales for many of you, is now 20 years old. And in 2025, no nurse should feel trapped at Band 5. With everything you do, nursing is much more than a Band 5 profession. Midwives and paramedics start as the same point as us, but the rules mean that they progress within a year. That gateway is denied for nursing staff. It has to stop. It is deeply insulting and fails to see and value the intrinsic value of nursing. So many nurses start and finish their career on the same band, with no recognition for the experience gained over their career, a lack of recognition for the autonomy you all have, the autonomy expected of us. Today, we are releasing this document to ministers everywhere the full case for change, a clear pathway to progression, meaning centrally funded structural change separate from the annual cost of living increase that we deserve. Newly registered nurses following a period of preceptorship should progress to a Band 6 as the new minimum. This will start to show our value and get people to see a future in this fantastic career. To stand a chance, we need all of you, all our members, to get active. The RCN is changing the way we do business. As part of our first ever RCN Activism Academy strategy launching this summer, we are investing in changes so that many more of you become active and get organised as the voice of nursing. As professional activists and active professionals, we will make nursing heard. We need all our members. It's not enough to be in the RCN. You are the RCN. We are investing in this college, its services, buildings, people and programmes like never before. Our strong profession needs a strong RCN, and our history is an asset. The RCN turns 110 years old next year. Meanwhile, health ministers across the UK are only in their first year on the job. Perhaps you could call it their preceptorship congress. Now, I'm not a politician, but I think we are the old heads here, the ones with experience. Ministers should show real leadership and work with us as the experts on what our profession truly needs to thrive, because we're building something unique here in the RCN, aren't we? We are at record size, well over 500,000 people choosing to be part of the voice of nursing. And last year, I was deeply honoured to take the permanent role as your permanent General Secretary and Chief Executive. I always say that nursing is an amazing career. To care for people at the most vulnerable times in their lives is a privilege. And to stand up for the nursing profession, to be able to see firsthand the breadth and depth of the work you do every day, I am determined to get what's been long denied to us. We also welcomed a new RCN President, Deputy President, Chair, and new Council this year too. The Council elections attracted a greater number of candidates and culminated in a more diverse Council. To our Council, our committees, our forums, thank you for all the work you do to drive this college forward. And let us not forget the work of our amazing reps, supporting our members. Across the UK, reps and RCN activists are working every day to make conditions better for our members and those you care for. Let me give you one real small but very local example. A few weeks ago, here in Liverpool, we acted for a nurse and we won. This member's employer hadn't acted on reasonable adjustments after a brain hemorrhage. It turned his life upside down. The RCN's brilliant team of lawyers helped our member to secure the very significant compensation he deserved. That is the real difference we make. It is with our members. It is with our members and for our members that we are the voice of nursing. So thank you. Thank you. And I believe that together we can make change happen. Before Congress last year, we launched our Equity, Diversity and Inclusion strategy something as an organisation we are living and breathing. It was your ask for us to become an actively anti-racist organisation, and we are making that a reality, because we believe that equity is not optional. It is essential for delivering high-quality care and better outcomes for patients. It is not a standalone issue. It is the golden thread that runs through everything we do. By the time we meet for Congress next year, our new member networks around protective characteristics will allow engagement and dialogue and support. From the way we develop our policies and elect our leaders, to the training we offer, the conversations we start and the support we give, it all matters. The recent UK Supreme Court judgment on the legal definition of sex in the Equality Act will have an impact on all of our members. We are carefully considering the decision, the impact on you, and the information, support and advice we provide. And we are intent on supporting every member to deliver discrimination-free, positive experience at work. Let's use Congress as a way to discuss the impact for our profession, our practice, our patients and colleagues. And members who want to discuss this more, please join the session at 5:30 today. Now, Congress, a very special person came to see us at the RCN earlier this year, keen to find out more about us and what we do, to learn about our profession, even to practice his resuscitation technique. You might have seen pictures of King Charles III, our royal patron, giving our excellent cadets a run for their money. His visit was a fantastic boost to the college, and His Majesty could not have been more interested in meeting the cadets trained in his name. Amazing young people who are looking for the first time at a career in nursing. Diversity of routes into the profession, diversity of the workforce reflecting the populations we serve, diversity of roles from nursing support workers through to executive nurses from executive backgrounds, unique perspective, but a shared commitment in providing compassionate care. So let's capitalise on that. It really is possible to inspire so many more people to join us in this profession. Young people can see the value that nursing has in society, and they have a passion for care and public service. But low pay and the prospect of working in underfunded services mean far too few consider it a career for them. Gen Z are the future of our profession, and they are key to transforming healthcare over the decades to come. Unlocking their talent must be a priority for every single government. Without enough people coming into nursing, it's a ticking time bomb. Large-scale retirement will remain a fear. We need stronger financial incentives to study nursing, better starting scales for new recruits, modern campaigns that reach young people where they are on social media, in schools and colleges. And some of the best nurses join after a first career in something else. Somebody I met recently told me that after 20 years in finance, she was about to qualify as a mental health nurse. This can be done. But RCN members, we call out the issues, but as we heard this morning, we must speak up our profession. Right now, the number of student nurses in universities around the UK is falling year after year. And look at Cardiff University and the consultation to close their prestigious nursing school, something we mourned about for years. I am so proud of the RCN members and staff in Wales for raising the alarm on this urgent matter and for saving the nursing course in Cardiff so far. And Cardiff is not unique. Let this be a lesson to any university around the UK. We, you, the RCN, will fight anyone and everyone to keep nursing degrees open. And just in case anyone anywhere is in any doubt, we will never give up our degree status. Your degrees recognise your work, and they make care safer for patients. It was hard-won and no compromise now. The education system does need fixing, but here's how. I attended an event for third-year student nurses a few weeks ago, all of them so proud to be graduating as registered nurses. And talking to them, I could see they were worried. One student told me they were struggling to afford to live while studying and completing their practice hours. They didn't feel supported. What they experienced on placement left many in doubt because they weren't treated kindly. And they couldn't give the care they wanted to give. 1 in 5 nursing students leave before they complete their course, no longer thinking it's the future they want. Just yesterday, we reported that students feel they're being used to prop up understaffed wards. We cannot have a situation where student nurses are burnt out even before they qualify. We cannot afford to lose a single person who would make an amazing nurse and touch thousands of lives. Colleagues, it's incumbent on every single one of us to look after our brilliant future nurses. And ministers, you have got to listen to them. Do the right thing and give today's final year students guaranteed jobs. Where students pay tuition fees today and recent years in England, refund them. Wipe away the debt in exchange for guaranteed service in the health service or care system. Treat them fairly, and they will act fairly. Treat them badly, and see what happens. Modernise not just the curriculum, but the whole way we educate a nurse. With our population changes, we all need to have a better appreciation for the expertise of mental health nursing. Parity of esteem making a real difference from the very beginning. Social care too. We are living longer with more complex needs. Before I came to this job, I was probably quite a hospital-centric nurse. I recognise that now. But last week, we brought together experts from across the UK for the RCN's first conference in social care, and to agree that the future of social care should be nurse-led. Let's educate. Let's educate the next generation in this kind of healthcare. Why? Because today's students will be working until 2070. Sorry to tell you that, guys. That's a long time. The world will be so different. We must keep this profession striving and advancing. And it's not just in the UK. From Gaza to Ukraine to Sudan, Ethiopia, the Democratic Republic of Congo and Myanmar, the last year has been a dark one for nurse safety across the world. Nurses attacked, killed, simply for caring for their patients. We are unequivocal in our condemnations of attacks on the nursing workforce. The killing of any nursing staff in any context, for any reason, is completely unacceptable. that message can go out from Congress again and from this hall all week. The RCN, under my leadership, will give practical support to nurses working in conflict. On Wednesday, you will hear directly from nurses on the front line in two conflicts, Gaza and Myanmar. I would encourage you all to listen to their inspiring experiences. But you should never be faced with violence and aggression when you go to do your job either. Safe environments to work at work is the least we all deserve. And stories are shocking. One nurse racially abused and then threatened with baseball bats. It had a profound personal impact on her. It left her looking over her shoulder when she went out in public. She was off sick for some time. Not an isolated incident. We can all share stories when we did not feel safe at work. The RCN pushed and published for new laws, but we need more. We want to hear directly from you. If you are not safe, you should never be expected to work in that situation. The RCN will always support you to stand up for your rights. Our people always deserve the highest levels of respect and protection. Our new employment standards support members to negotiate fair pay, terms and conditions in the independent sector. When you're off sick, you shouldn't lose money. The RCN lobbied and now statutory sick pay is changing. It will allow for more nursing staff to access sick pay when they are unwell, taking away real worries. It was the RCN that got the bill amended in the Scottish and Welsh governments and gave them the power to introduce collective bargaining arrangements in adult and social care too. We want ministers everywhere to tackle employers who abuse their staff, put a proper floor on pay, terms and conditions. That's where many of my discussions lead, to talking about paying nurses fairly. I was astounded when an official government report found that nurses earn less and give more free time than any other health profession. If their report says it, then let's address it. How seismic would it feel if government started to pay every single overtime that you do? Stop taking advantage and pay that nursing overtime bill. For those of you who work in the NHS, your pay awards were due on the 1st of April, 6 weeks ago. This hits those in the lower pay bands the hardest. And it's just not the impact on your livelihoods, but whether some of you will meet the salary levels to remain in the UK. It's now been a whole month since the pay review body gave its report and recommendations to the government. Still no news. Scotland, not for the first time, has a pay offer first. If you work there, you have until Wednesday lunchtime to vote. Scotland has direct negotiations with the Scottish Government, which is exactly what we've been calling for across the UK. But other governments rely on the pay review body. It is not independent. It is outdated and takes far too long. Unions like us have stopped participating. I don't want to hear ministers proudly say this summer, we paid the recommendation of the PRB because we don't recognise it. It was never going to give ministers the unvarnished truth about what's really needed. And what is that? A significant pay rise and our pathway to progression. For every NHS employer to give the full amount of money and pay it. Anything else is a cut in patient services, and general practice nurses to be given at least the same uplift as Agenda for Change, not expected to have to wait even longer. Government, stop the dither, stop the delay, make the announcements today. Let us know what we're dealing with. And look, I'm not here today to tell you that we're going on strike, but I'm not here today to tell you that we are not going on strike. That's not my call. You need to decide how you feel. We will plan together and guess what's best for nursing and what it needs. But to ministers, I will say this: do not sail close to the wind. Continue to insult this profession, leave it ailing and underpaid this summer, and you will know that this could escalate. If you think we won't bare our teeth, I am telling you we will. I can feel the determination in this room and across this profession to fight for more. And it's bigger than our pay, and it is always about patients. Because what happens now is dreadfully unsafe. One registered nurse to 15 patients, 20 patients. A nurse told me she was the only registered nurse left to care for 40 patients. This takes advantage of your goodwill. It shows a lack of professional respect for nursing. And there's a real guilt that you take home when you've not been able to give the essential care you need to give for your patients. And now we're hearing that hospitals are cutting staffing levels again and making people redundant. We will fight every step of the way. It's the wrong direction, and it's so dangerous. In some settings, Wales already has safe staff legislation. Scotland's Act is already a year old, and the Northern Ireland will follow soon. Our refreshed nursing workforce standards are being launched today. As the RCN, we're campaigning for the introduction of safe nurse-to-patient ratios across the UK. An airplane doesn't take off without enough staff. A dog walker is limited to the number of dogs they can walk down the street, but they think it's okay for you to compromise and cope. Enough, colleagues. Safety is not an optional extra. Safety is not an optional extra. It should be the standard. And the Royal College of Nursing will bring together all of the evidence and all of the advice in every setting to support every single individual to work safely and brilliantly. Last year at Congress, we declared a national state of emergency on corridor care. These conditions are not the norm. If we give an inch, they take a mile. Be clear, we do not accept it. Elderly patients and mental health patients waiting for days for treatment in stressful and brightly lit A&Es, a scandal in plain sight. The people who wait the longest are the most severely mentally ill. If parity of esteem between mental and physical health is to mean anything, then these utterly degrading waits must end. Nothing less than urgent and sustained investment in acute and community mental health nursing can ensure that everyone gets the timely care in the right place. Turn people's lives around and ease the pressure on emergency departments. We got the politicians finally talking about corridor care and feeling the pressure to find solutions. In January, we published a report documenting the experience of over 5,000 individual nursing staff, 460 pages of harrowing testimony. It was your voice that forced the Health Secretary to confront this in Parliament in Westminster. It was your voice in the NHS in England to be transparent about their data. It was your voice that forced debates in the Senate. It was your voice that led to talks with Scotland's First Minister and Cabinet Secretary. It was your voice that led to transparent data in Northern Ireland. So thank you for speaking up, because that's how change happens, with our collective voice. When we show our worth, we are not quiet. The RCN is the voice of nursing. You are that voice, and we are raising it. Nobody should ever mistake our kindness for weakness. The picture I paint today is the state of nursing in 2025. I want a year of real change, reform and investment, one that begins to turn the page. Because in nursing, we are the true change makers, and we are not pulling back. Invest in us, allow us to thrive, and see our patients reap the rewards. Now, Congress, I ask again, do we value ourselves? Does the nursing profession across the United Kingdom really know its value in 2025? Thank you.
Thank you very much, Nicola. Thank you. Great speech. We're just reorganising the stage for 1 minute, so our President and Denise have just left the stage, and we are shortly to be joined by Tristan Griffin, the new Member of Council for Wales, and
scrap these unfair cuts and instead do the right thing by taxing the super rich so they can pay their fair share.
I hear very clearly what my honourable friend says, but I also want to be clear to the House. For people who can never work, we want to protect them. For disabled people who can work, we want to support them. And the truth is that if you are a disabled person and in work, you are half as likely to be poor than if you are out of work. We want to improve people's chances and choices by supporting those who can work to do so and protecting those who cannot.
Sir Roger Gale.
Mr. Speaker, personal independence payment is, well, the name is on the tin. It is designed to enable people to live an independent life. As one who's represented constituents on tribunal appeals, I know only too well that while there are many who should not be claiming PIP, there are also many whose disabilities may not be immediately apparent.